So in today's lecture, we'll be looking at the heart meridian. So the full name of this meridian is the heart meridian of the hand shaoyin. So what this refers to is, firstly, it's the meridian on the hand. And because it's a yin meridian of the hand, this means that it's going to run from the chest down to the fingers. And then secondly, because it's shaoyin, this means it's the most posterior of the three yins when it runs down the arm. So it'll be behind both the lung and pericardium meridians. There are 9 points in total, and the common indications for points on this meridian. So firstly, it can be used for diseases related to the heart. So what it's referring to here is diseases related to the heart's function. So remember, the two functions of the heart is firstly that it governs the blood and the blood vessels. So that means this could be used for conditions affecting either the blood or the blood vessels, which could be conditions such as high blood pressure. It can also be used for disorders affecting the actual heart, which would be conditions such as chest pain or palpitations. Secondly, the second function of the heart is it houses the mind, and that's why it's got the second functions here to treat mental disorders. And this will be conditions such as insomnia, poor memory, etc. And then finally, it can be used for diseases related to the flow of the meridian. So what this is referring to is diseases along the arm. So it could be used for elbow pain, especially on the medial aspect of the elbow, or wrist pain. Now let's look at the course that this meridian flows. So this meridian originates in the heart over here, and then it branches in 3 different directions. There's an ascending branch, a descending branch, and a straight branch or a lateral branch. So we'll follow the lateral branch, and what happens is that it emerges out of the cardiovascular system and ascends slightly to the lungs, and then runs down to emerge at the axilla over here. It then runs along the medial aspect of the upper arm down to the cubital crease, and it is the most posterior of the 3 meridians. So the 2 other yin meridians, the lungs would run here, and the pericardium would be running around here. So this one would be the most posterior of the 3 yin meridians. Then from the upper arm, it continues down to the cubital fossa over here, and then continues descending until the pisiform bone, which is over here. And from the pisiform bone, it runs along the palm of the hand, and then runs up the radial aspect of the little finger to its tip, which is heart 9. So it's running on this portion of the little finger. And then from here, it connects to the small intestine meridian. So there were the 3 major branches we talked about. The straight branch, which we went through already. Then the ascending branch. So here's the ascending branch, this portion here. So this portion ascends along the esophagus and ascends all the way up the face and connects with the ophthalmic region up here. And then the descending branch. This branch descends through the diaphragm and continues downward all the way to connect to the small intestine, the associated organ of the heart. Next, the frequently used points. So there are 6 frequently used points. Firstly, JIQUAN, heart 1, then SHAOHUI, heart 3, TONGLI, heart 5, YINXI, heart 6, SHENMEN, heart 7, and SHAOCHONG, heart 9. So now we're going to move on to the first point of this meridian, JIQUAN, heart 1. So this point is located in the depression in the center of the axilla, on the posterior aspect of the axillary artery. So if we look at this image I've just brought in, this image is showing the axillary artery in a bit more detail. So as you can see, it runs over here. So as you can see, it runs more on the anterior aspect of the axilla. So we need to be just posterior to it around this region. And then this point can be used for precordial pain and palpitations. It can also be used for intercostal neuralgia and paralysis of the hand. Thirdly, it can be used for scrofula. And fourthly, for axillary odor. Our insertion is perpendicular, 0.3 to 0.5 tsun. And then remember here, we've got to be cautious and ensure that we avoid the axillary artery, which we just talked about here. The next point is QINGLING, heart 2. This point is on the medial aspect of the upper arm, 3 tsun above the transverse cubital crease, on the line connecting heart 1 to heart 3. So how you locate this point is you first locate heart 1 in the axilla, then you will locate heart 3 over here. We'll learn about how exactly to locate heart 3 in the next slide. And then we're going to draw a line to connect these points like this. And then this point is 3 tsun superior to the cubital crease. So what we know is that from the anterior axillary line, which is around here, to the cubital crease over here, this distance is 9 tsun. So all we do is we divide this distance into 3 equal parts, like this, and then this part is on the lower third, which would put it around here. This point can be used for headache, shivering, pain in the hypochondrium, and pain in the shoulder and upper arm. Our insertion is perpendicular, 0.3 to 0.5 tsun, and here we need to be careful of the brachial artery. So if we look at this image here, firstly, this image shows you the different regions of the abdomen. So when we refer to this point being able to treat pain in the hypochondrium, it's referring to these 2 hypochondriac regions over here. So what you would need to do is ensure that the patient is having the pain in this region. Usually they would say they have pain on the side of their body, and then you must just locate where particularly on the side of the body it is. And then the second image over here, so this image over here shows the brachial artery, this artery over here. And then because of the location of this point, it runs very close to this point. If we found it on this image here, so what we'd first have to do is locate heart 3 down here and heart 1 in the axilla, and then divide this distance in 3 equal parts. And this point would be on that line connecting the 2 points, which would put it in around this region. And as you can see, this region is quite close to where the brachial artery runs. And therefore, we need to first palpate and ensure that we're not on the brachial artery before we perform our insertion. The next point is SHAOHUI, heart 3. This is the Hersey and water point of the meridian. And this point is located when the elbow is fully flexed. This point is at the depression on the medial end of the transverse cubital crease. So this crease over here that forms when you flex the elbow, this point is on the medial end of this crease. It can also be located using the midpoint between pericardium 3, which we'll learn about in a later lectures. But if you look at this image over here, pericardium 3 is this point. And then the medial epicondyle of the humerus would be palpated around here. And then we divide this distance in half, and that's where heart 3 is. And can you think back to previous lectures on a point that was found in a very similar way to this point? So this was large intestine 11. It was found in a very similar way, except on the opposite side of the biceps brachii tendon. So we used different points. We used lung 5 over here, and we used the lateral epicondyle of the humerus, which is around this region. And midway between these 2 points was where large intestine 11 was found. So the indications for heart 3, this point can be used for precordial pain, hysteria, and mental disorders. It can also be used locally for spasmodic pain in the elbow and arm. Then it can be used for hand tremors, hand numbness, and elbow pain. It can also be used for head and neck pain, axillary and rib pain, and finally for scrofula. Our insertion on this point will be 0.5 to 1 tsun. The next point is LINGDAO, heart 4. This is the Jing River and metal point of the meridian, and it is located 1.5 tsun above the transverse crease of the wrist, level with heart 7, SHENMEN, and it's on the radial side of the tendon of the flexor carpi ulnaris. What you do when you're locating heart 4, heart 5, and heart 6 is you first need to locate heart 7, which is over here. And we'll talk a bit more about how exactly to locate it in later slides. Firstly, you locate heart 7, and then we're going to go 1.5 tsun above this. And how you would determine 1.5 tsun is if we look at this image here on the right. So remember that the distance from the wrist crease to the cubital crease was 12 tsun. So what we'll do is we can divide this distance in half, which would give us 6 tsun, in half again, 3 tsun, and in half one more time, and that's 1.5 tsun. And that's where this point is located. And then the next step is to find out where along this line it is located. And this is in the second point here. It has to be on the radial side of the tendon of the flexor carpi ulnaris. So here's the flexor carpi ulnaris, this muscle here. And the tendon, if you follow it all the way down, runs here and connects to the bones over here. So we need to be just on its radial side, which is towards the radius, which is here's the radius. So we're going to be on the right side of it in this image. Our location would then be where these two lines intersect, and then just radial to that, which will be over here. And then LINGDAO can be used for precordial pain and schizophrenia. Can also be used for a sudden loss of voice, or locally for cramping pain of the elbow and arm. Our insertion is either perpendicular, 0.3 to 0.5 tsun, or we can do an oblique proximal or distal insertion, and then we go slightly deeper to 0.5 to 1 tsun. The next point is TONGLI, heart 5, and this is the luau connecting point of the meridian, and is located on the radial side of the tendon of the flexor carpi ulnaris. So that's the same as heart 4, but this time the only difference is it's 1 tsun above the transverse wrist crease instead of 1.5 tsun. So we located exactly the same as the previous point, except we're now going 1 tsun above the wrist crease. And what you can do when locating these points is once you've located heart 4 over here, we know this distance from here to here is 1.5. So if we divide this distance into 3 equal parts, then we can use this to help us find heart 5 and heart 6, which will be at each one of these marks. And then each time we've got to ensure that we're on the radial side of this tendon over here. This point can be used for palpitations, stiff tongue, aphasia and sudden hoarseness of the voice, and it can be used locally for pain of the wrist. Our insertion is perpendicular, 0.3 to 0.5 tsun, and there are 2 cautions here. Firstly, that we should not do deep insertions, as these could damage the ulnar arteries, veins, and nerves. And if you look at this image on the right here, this image illustrates clearly which nerves and arteries run in this region. So this point is located in around this region here. And you can see this is very close to where these arteries run. So this is why we've got to be extra cautious on our depth of insertion. And then the second caution is against bending the wrist once the needle has been inserted, as what can happen is that the needle can bend if they bend the wrist too much, as the wrist bones move medially and close to this region when they start flexing the wrist. And then one last note here is this type of palpitations is a very specific type of palpitations for this point. And what it refers to is palpitations that are accompanied with an intense fear, and usually this is due to a deficiency cause. So we would use this point specifically for these types of palpitations. Our next point is YINXI, heart 6. This is a Shi cleft point, and it's on the radial side of the tendon of the flexor carpi ulnaris. So that's the same as the previous 2 points, and this time we 0.5 tsun superior to the transverse wrist crease. So like I mentioned in the previous one, you can locate heart 7 and heart 4 up here and divide it into 3 equal portions. And this time we're on this portion here. And then once again, just radial to this tendon. So firstly, this point is a Shi cleft point, which means it can be used for acute conditions or emergency conditions. So this point can be used for acute sudden onset of chest pain. It can then also be used for other conditions such as angina pectoris or arrhythmias. And then secondly, for tidal fever due to yin deficiency or for night sweats. It can also be used for hematemesis and epistaxis. Our insertion is perpendicular, 0.3 to 0.5 tsun. And then we've got the same 2 cautions as the previous points. Firstly, against deep insertions, as they could damage those ulnar arteries, veins, and nerves. And secondly, that the patient should not bend their wrist once the needles have been inserted. The next point is SHENMEN, heart 7. So this is a shoestream, yuan source, and earth point of the meridian. And it is located at the wrist joint on the radial side of the tendon of the flexor carpi ulnaris in the depression at the most distal transverse crease of the wrist. So we locate the most distal transverse wrist crease over here, and then we're going to be just on the radial side of this tendon, and that's where heart 7 is located. So firstly, heart 7 is a yuan source point, and remember that yuan source points can be used to treat conditions affecting their associated organ. So in this case, this point can be used to treat conditions affecting the heart. And even though other points on the meridian, because they're on the heart meridian, can also do this, the yuan source points are much more potent in this action. And this is why it can be used for all these conditions in number 1, which are symptoms such as precordial pain, vexation, palpitations. That's all got to do with the first function of the heart in governing the blood and the blood vessels. And then the second aspect, the poor memory, the insomnia, the dementia, epilepsy, and other mental disorders, is related to the secondary function of the heart in housing our mind. And then also the secondary indication for hypertension is again due to the fact that the heart governs the blood and the blood vessels, and therefore a disorder of the heart could lead to disorders in the blood pressure. And then finally, this point can be used to treat pain of the chest and hypochondriac regions. Our insertion for this point is perpendicular, 0.3 to 0.5 tsun. And once again, we have a caution here as the ulnar artery lies adjacent to this point. And we must be cautious, therefore, not to insert our needle into the ulnar artery. And then one note here is that the palpitations it refers to here is the same as the luau connecting point, heart 5. It's those palpitations that are accompanied with an intense fear, and this is due to a deficient cause. The next point is SHAOHUI, heart 8. This is a Xing spring and fire point of the meridian, and it is located on the palm of the hand in a depression between the 4th and 5th metacarpals, where the tip of the little finger touches when a fist is clenched. So how we locate this point is that we ask the patient to make a fist, then we note where the little finger touches and ask them to open their hand again, and then we go to this location, and then we ensure that we're still between the 4th and 5th metacarpals. So here's the 5th metacarpal, this bone here, and then this is the 4th metacarpal over here. So we must ensure that our point lies between these two. The indications for this point, it can be used for palpitations, chest pain, pruritus, and pain of the vulva. It can also be used for carbuncles and pyogenic infections and ulcerations of the skin. And then finally, it can be used locally for cramping and pain of the little finger. Our insertion is perpendicular insertion, 0.5 tsun. And then the final point on this meridian is SHAOCHONG, heart 9. This is the Jingwell and Wood point of the meridian, and it is located on the little finger, 0.1 tsun from the corner of the radial side of the finger. So this is the radial side here of the finger. So we're on this portion, and then we got to find the corner of the nail, finding its posterior border and its radial border, and then we must go 0.1 tsun away from it in this direction. This point can be used for palpitations, precordial pain, mental disorders, coma, and other heart and mind disorders. It can also be used for febrile diseases, as well as any other condition related to heat. And then thirdly, it can be used for pain in the chest and hypochondriac regions. And our insertion is a perpendicular shallow insertion, 0.1 tsun, or we can prick this point to cause bleeding with a 3-edged needle. And that's the end of the heart meridian. Next, we're going to be looking at the small intestine meridian.